I'm Brett Teran, and I'll be talking on chronic pain. So I've been here 10 years now. It's amazing to kind of think back in that time frame. And one of the things I thought about in putting together this talk, I just really wanted to have you learn something, obviously, something exciting, and hopefully you'll get something out of this topic. So I have no disclosures. The objectives, so the first thing I wanted to just bring up is, by show of hands, how many people here have had a pain that you thought, oh no, this is not going away, after an injury or something like that? How many? Okay. Got to check the pulse of all the rest of you, because I think you might be lying. But so imagine that, obviously, and some people go about their lives and they have definitely chronic pain and you wouldn't even know it. So just to kind of go into that topic a little further, that pain that you thought of and that you had, oh no, this is never going away, just imagine that being all the time. And it's something people deal with. I'm going to present a little more on that in the prevalence of chronic pain. I'm going to talk about a little bit more of the theory of chronic pain, and talk also about some specific topics within chronic pain, and that's post-surgical pain. And then just to kind of really talk about more future directions of pain, which is some research and technology. So it was already stated about the surgery center. We're going to skip over that. That was an excellent thing. I'm really fortunate to be in the practice that we're in, and have that exciting thing that's just about to open. It's been a long time coming. But for a shameless plug, quick, for the Plymouth Bay Orthopedic Associates, we serve the Plymouth community. We are specialists. Myself as a pain specialist and a physiatrist, and my surgeon colleagues, we have physical therapy and occupational therapy on site. We're multi-specialty. We handle things acute and chronic, and we have a pain center, in case you don't know that. And that is where I spend a majority of my time, practicing in the field of pain, doing fluoroscopic guided, ultrasound guided techniques, and a wide variety of interventional techniques, and as well as regenerative medicine, a whole different topic. So we're going to dive right in and talk about some of the history. Everybody's favorite thing. It's New England, right? We're big on history here. As far as chronic pain, this is really meant to show you that we have come a long way. Ancient times, we thought pain as a spiritual or karmic consequence. Fast forward many centuries and centuries into time to this 19th century, we have the Descartes, who thought of the perception of pain in the brain. And from there, anesthesia was discovered around that time, used for surgeries. Jumping forward another century, we have more expansion of the knowledge of pain, pathophysiology and treatment. And then even further, as far as the history, we're in now to this really developed understanding of pain. We know it's complex. There's this interplay that happens. It's physical, psychological, social. All these factors play a role. And that's the important thing to know at this time, that we really dove into that as far as our research and understanding. So this is not a talk on pharmacologic treatment. It is a part of treating it, and we know that as far as helped for chronic pain, psychological therapies, interventions, and alternative treatments should be mentioned too. So as far as the pathophysiology of pain, I again mentioned as far as what we thought in ancient times, that it was divine, that there was some supernatural punishment to have pain. There was Hippocrates' imbalance of bodily fluids, that he thought that was the reason. And jumping further into Renaissance times, where you have Da Vinci over here pictured his drawings of nerves, and also Descartes, who looked at more of a dualism or mind-body, that the mind and the body are separate entities. So we've come a long way from that, and even into the 19th century, there was two researchers, Mueller and von Frey, and many others as well, but those were the main researchers that really looked at specific nerve fibers. And they were able to really quantify and see specific areas in the body where nerve fibers exist. And this research is documented well in that century. Fast forward again to the 20th century, where we have something called the gate control theory. And I'm sure many are aware of this. It's pictured there on the right, where essentially you have pathways of fibers. You have different fibers that pick up different types of pain, and small fibers and large fibers. So if you have a shoulder pain and you injure yourself, you fall and traumatize the shoulder, then that pain is sent through signals, as it's showing on the top. But what can happen is that you can shut off that reception to the brain, to the pathways of the nervous system, by stimulating the large fibers, and that's showing blocking that signal. So from there, there's a lot of theory behind that has been really focused, and the research has been done on that theory, and there's more to it. And we know that now, that as far as the 20th century goes, there's I'm sure we're all familiar, the biopsychosocial model. So that speaks for itself. There's biologic factors, there's psychological factors, and there's social factors that all have a role in a pain response, somebody's response to their pain, feeding into that. So you can see that on the picture. More recently, we've expanded our knowledge even further. So again, as I said, we've come a long way. Now we know about nerve injuries, different types of cells interacting in the nervous system, inflammatory mediators that are important. These factors are all things that we study. And there's something called central sensitization. So this is essentially the body or the nervous system changing over time, adapting to inputs. And it happens so frequently. Over the past very short while, we've known about this phenomenon, and it's really highly studied. So from these expansion of knowledge for the pathophysiology, that has helped us to develop treatments, and specific pharmacologic treatments and interventional treatments for pain. So as any of us do, maybe ourselves or patients, what happens when they have something, right? They have a condition, they have sensation, a problem that came up on their lab work. What do? They're going to look up on AI, right? It's no longer in the Google phase, right? Where everybody was Googling everything. Now everything is looked up. We're going to look it up on AI. So if you look it up, you're going to see chronic pain, persistent pain as the definition, lasting longer than 3 months or beyond the healing time. You can even Google, along with AI, but also same thing, Chat GPT, similar definitions. So just to be aware, bringing up that this is where patients are looking up, they're reading this information, they're trying to educate themselves on this condition, and just to be aware of that. So over on this slide, causes of chronic pain. So I put this picture up. Fortunately for us, the patient or the person depicted on that picture is most likely probably one of our patients at Plymouth Bay. Unfortunate for him, but fortunate for us. And as you can see here, just many different causes of pain. They come in for the neck, their shoulder, their lower back. We have a specialist for those things. But it's complex. And when it comes to chronic pain and someone's experience of pain, it can be many different forms. And that's neuropathic or nerve, musculoskeletal, like bone, joint, ligament, muscle, visceral, body organs, inflammatory causes, such as autoimmune or chronic inflammation, like lupus or rheumatoid arthritis. And then mentioned again is the central sensitization that we know a lot more about lately. And again, it's that changing of the nervous system over time, adapting, and essentially kind of having that input always turned on. Sometimes there's no direct cause. Sometimes there's emotional and psychological factors that change the nervous system, and we call that psychogenic pain. So these are the types and causes of pain. Risk factors for chronic pain, they can be any number of these things. You can see over there on the right, pickleball was mentioned quite a bit earlier, guys. So, I mean, pickleballitis, I mean, it's a real thing. But it's wear and tear, chronic musculoskeletal pain, aging, genetics, previous injury, manual labor, those types of risk factors that we know of. As far as the prevalence, so I spoke to this, but essentially, we see data that now that chronic pain exists. It's very prevalent. 1 in 5 U.S. adults are dealing with chronic pain. And that has led to a lot of costs, over $600 billion annually for this condition. Management is difficult. Management can be difficult task to mount given the complexities. So because of that, the research has been dedicated to a lot of preventative measures, as it should. And these things have led to more recent improved screening tools, personalized care, like modifying those risk factors, lifestyle factors, which I think as it should, and we really are developing more and more because we're focusing more on the preventative nature of this. Now I'll go and speak to a little bit more. I realize the audience, I do have my surgeon colleagues that are in the audience today, and I am followed by Dr. Leckie, so whatever I say, he probably has the last word on this, but chronic post-surgical pain is a condition that is fairly prevalent. In speaking particularly about this article about lumbar spine surgery, it's about 15 to 27% in its prevalence. It's complex. There's a pathogenesis that is involving many aspects of this condition, and I'll speak to that in just a moment. But the current treatment is particularly important to be multimodal, or multiple things that we can do at once to help someone through this condition. There is a role on this article specifically to talk about neuromodulation, which is something that I practice, Dr. Leckie practices, a lot of us are familiar with this treatment. So it's not a talk on that, but it certainly was brought up in this review article. It's a fairly recent article as well. But the points that I want to take here are that preventative measures are mentioned and are important in this condition, given its prevalence, the complexities of it, the treatments that we have to help it. But the preventative treatment is that we try to reduce the amount of fibrosis, inflammation, and sensitization of the nervous system around this area in the spine. There are inflammatory factors, as I saw Dr. Keniston's did talk briefly. It mentioned TGF-beta 1, which is one of those inflammatory factors. And there are medications that they have been testing, particularly in animal models, to try to help modify this. It should also be stated that there are some regenerative techniques that are certainly out there in the community and all over that are being utilized in research to try to help with this condition as well. I brought this up particularly, this was another study on chronic post-surgical pain, just diving into that specific topic. And again, I mention this because it is something so prevalent for all of us in our field, and particularly as chronic pain, and it's a subset of that. So this schematic is really meant to help us try to organize the information, a step-by-step approach to chronic post-surgical pain. Identifying risk factors. So in green there, you can see each factor as far as trying to help. So there's risk factors up top. Did they have, what type of preoperative pain do they have? And high risk, are they high risk? Is this a high risk surgery? And whether or not you're treating that pain, acute postoperative pain control is important. And then persisting pain. So does it move into the chronic phase? So those are all in green, those factors. And then in the middle, essentially, is identifying those a little further each time. And then on the right is the treatment plan, what we can do to counteract these things. So I thought it was just a good slide to kind of show this particular review paper, the evidence, how we can help somebody in chronic post-surgical pain, and spell it out very, very specifically. So some other interesting research that I found more recent, this was within the past 2 years, was using spinal cord stimulation in helping post-surgical pain, post-spinal surgery pain. And this was an animal model study, but it still does show that, again, mentions about central sensitization. That's a common topic that I've been talking about as far as post-operative pain. It's challenging to control, it's difficult, but what they did was that they studied mice And they did one-time intraoperative spinal cord stimulation sessions, and they found that there was this lasting effect, a week's lasting effect that suppressed this mechanical sensitivity in the spine. So it's quite interesting data that they came up with this study, and there's more studies to come, but I thought it's worth mentioning. So also out there in some of the research and things I've been reading is particularly about stimulation, but also in this way, deep brain stimulation. So there is a meta-analysis systematic review, again, within the last few years that really dove into trying to see the effectiveness for this treatment. There was even, I think, a New York Times article talking specifically about patients undergoing this type of treatment. So you'll see that it's out there. But this is the first comprehensive study to really identify, is this effective for chronic pain? And it is. It's been shown to reduce. It's been shown to have a positive effect. It is invasive to perform this, which is why more studies are needed for more non-invasive stimulation to see if that'll hold up. But it is quite an interesting treatment that is, I think, going to grow. Just to talk a little more about the latest research in chronic pain, again, these studies are very recent, so things, again, that I'd hope you'll get out of this talk. But in October of 2024, they essentially mapped cross-talking patterns in the brain 1 to 3 days after whiplash, and they found that they could predict the chronic pain of a patient, of a person after that injury. It's quite exciting. In April 2025, there was another study that really showed how that we can map actually these sensory pathways, these nervous system pathways, and particularly use that in the field of chronic pain. And then finally, just a recent study this month came out where they were able to map small groups of neurons responsible for a chronic feedback pain circuit. And they showed that, well, if we can map this out, then we can essentially try to regulate or modulate it and essentially alleviate these responses and hopefully prevent it from developing into a chronic pain state. So what I want you to know is these things are happening so quickly. We're advancing in our research and knowledge, which is important to just know. And then also the really takeaway from this is that, you know, though our knowledge from research is expanding, a lot of our treatments are kind of slow to develop and improve. And that's the thing we're hoping to do. Finally, just to talk a little bit more about chronic pain and technology. So I think VR is pretty ubiquitous at this point. We all know what it is. Maybe kids playing with it. I know my kids are. Anything they can do to kind of, but it's quite fascinating and interesting, and especially applicable for use in pain, in mindfulness, in retraining the brain. It's been shown to reduce that sensation of pain. So pretty interesting stuff. As far as technology, how many here have a watch, wearing a watch or Fitbit, any of those things, right? It's everywhere, right? We're all using it. We're all checking our sleep time and, you know, how many steps we have and all that stuff, right? So this just mentioned it, that I could do a whole talk again on this particular topic. It's very interesting, though. We're gathering a lot of data is what we're doing, right? We're seeing how we interact. We're kind of diving into that. So it can be a little bit of a double-edged sword. It does help us quantify, say, in a pain patient, like how active are they? How difficult it is for them to move? Is their sleep affected? Those types of factors. But it can be a little bit too much, too. So there's a sweet spot, I think, as far as these wearables, these technologies that we have. But I, like Dr. Sharma, kind of a tech geek, so this is really important. I think it's great that we have this very advanced in this time frame. I mentioned applications. There's actually, if you guys don't know about it, you can look it up on your phone, look for any applications as far as chronic pain goes. And I think you might see this one. It's called Curable. I don't have any financial implications of that, but Curable is an app that essentially is an educational tool. I actually tried it out the last week and really got into it. And it's AI, but it's also got talks on there, education, really kind of personalizes it to, depending on the person, on the patient. Quite interesting stuff that it's really trying to guide a patient through chronic pain, help them understand what they're experiencing, and that goes a long way for patients. And then finally about AI. I was mentioned before, but it's really, it's a tool still at this point that we can use. It can recognize and predict, it can help us. It certainly shows us a lot of information, but we can use it to adapt. And particularly this last little picture there that shows that in the field of neuromodulation, we can actually use this technology to help us in a feedback loop, not only just giving us feedback into the treatment, but we can also adjust it, and it'll adjust in real time. So I thought that was really interesting to bring up too. So in summary, I just hope that you got something out of this. It's kind of a crash course in looking at chronic pain, not to be meant to be comprehensive, but just looking at where we were, where we are now, and where we're going, and a little bit about some of these more specific post-surgical pain and chronic pain, some of the research and technology that really is quite exciting. Those are my sources, and thank you for the time.